Troika is a brand consulting, creative design, and content group that holds the view that brands are a company's most valuable asset and that the most enduring brands forge strong emotional bonds with audiences and supporters. To assist brands in converting audiences into ardent fans, they adopt a fan-centric perspective that guides the way they think, create, and design. Their craft is a blend of art and strategic thinking to create a holistic and meaningful brand experience that builds highly engaged, loyal audiences. Using immersive live experiences, brand partnerships, PR, social media, and influencer marketing, Mission is a communications company that helps brands stand out by interacting with consumers from a cultural perspective.
You're watching America Trends. I'm Mary Burt Godwin, and we have a special guest zooming in today, Dr. Taylor Day. She is the founder and CEO of Dr. Tay Concierge Clinical Care, licensed psychologist, and she specializes in neurodivergent, affirming care for autistic children and their families. So Dr. Tay, I love that nickname. So can we talk about concierge therapy, and is that what you provide, and what is that? How is that different?
Yeah, so I actually got the idea from looking within the medical field. There's what's called direct primary care, which is actually allowing you to have greater access to your primary care physician. And I was like, why are we not doing this in the therapy world? And so I ultimately built my practice where families have much greater access to me. Things that I include, we are doing regular weekly sessions, but then families are able to contact me in between session for ongoing support as well as to share wins. But then they're also able to, consult with me if they need help with care coordination. They're navigating the school system. They can ask questions, and I actually will get involved and help coordinate care there so that all of the child's care team is on the same page.
Wow, that's pretty awesome. I mean, that seems like quite a bit of work for you. So do you have to limit the amount of kids you take on at one time?
Yeah, so in my one-to-one therapy model, I definitely keep a lower caseload so that I can provide that higher quality of care. Yeah. And I also have a group therapy model as well that allows me to work more with many families. There's a little bit less of that integrated care coordination, but it's still there. I have no problem shooting off an email that if that's going to ultimately help the family. And so that allows me to be able to work with more families simultaneously.
I love that. Can you talk a little bit more about the group model? I mean, I'm envisioning, a meeting, a recovery meeting or something where people sit around in a circle and get to share their experiences with one another, which I think is pretty incredible. I have a friend of mine who is raising two sons with autism, and she is incredibly vocal and speaks a lot on Instagram and different places. And I believe she leads meeting type of situations because she's a single mom. She needs support, and she's now giving that out to other people because she received it. So could you talk a little bit about that?
Yeah, I mean, I absolutely love that. And I love seeing parents, create these types of communities. And I think it's so important because the journey can be lonely. Sometimes other families and friends aren't going to understand what you're going through. For example, your child may finally say a two-word phrase, and maybe you have families who their children have already done that and it didn't feel as big and momentous. And so having a community to be able to celebrate that that really truly understands. I love the community aspect. Parents learn from each other, they support each other. And what's really unique about this, unlike a support group, is you're working with a licensed psychologist. I always say you have me in your back pocket. So late night scrolling, instead of going to Google and being like, why is my child doing this? You can come into our community chat and answer that. And, I'm in there multiple times a day answering questions and providing the guidance that is needed.
Wow, that's pretty cool. And do other people, is it like a Facebook group, let's say, where users can also say, I have the same question, thanks for asking, or, oh, this worked for me. This is what I've experienced. Maybe this might work for you too.
Absolutely. And I think that's the thing is, we all have different experiences and are coming at it with different lenses. I have the clinical training and working, with many families of autistic children over the year. I have the lived experience of being a sibling, but I don't have the lived experience of being a parent of an autistic child. And so I'm all about community and collaboration and empowering parents. They are the expert of their children. And so if they can help one another, I think that's a beautiful thing.
So let me ask a question as far as, like I was mentioning before, even the term, autistic child versus child with autism. I believe that some people might feel a little bit maybe hesitant to speak to somebody that they know has a child with autism. What are some tips and tricks for maybe employers or coworkers, friends, to show support, help speak about it, maybe not be afraid to talk about it, right? Because probably the parent wants to talk freely about it. And it's like, don't think there's an elephant in the room, right?
Yeah. Oh, I love this question so much. And I think that is the important thing, is being willing to have these conversations. And I think the best way to approach this is actually asking, the parent, or if you're interacting with the autistic individual themselves, are there things that they want you to know, and allowing them to really take the lead and share their journey and their experience. And I think the more that we can be open-minded and asking about, hey, are there any accommodations, things like that we can make to really be supportive of your child, that creates an accepting place. And I would say, if you have a neurotypical child yourself, the more that you can educate your children on neurodiversity and that brains think differently, that's how we're going to start to create more of an accepting world.
Did you watch the show Atypical? I loved that show.
Yeah.
So, let's go out with some, you were talking about tips now for parents that might be suspecting and or might have questions about this. What are the best ways? Do you see families from all over? Like, can you see patients via Zoom?
I do. My practice is largely done in that way. I think with the pandemic, we saw this, access increase through telehealth. And I actually find this to be such a valuable tool, because families are able to get access to a licensed provider even sooner, often in this way. The other thing is, I actually love it as a psychologist, because whether I'm doing a diagnostic evaluation for autism or we're doing therapy, I get to see your child in their natural environment and in the situations and different, even rooms in your house of where things happen. And that really helps it to feel more naturalistic and for me to really have an understanding of what's going on. So keeping, an open mind that telehealth really, I think, is the way of the future, or really even the way of now.
Right. It's so helpful, and not having to commute to go to different states or cities or whatever. So people can find you at dr.taylorday.com. Is that correct?
drtaylorday.com.
drtaylorday.com. And your Instagram is at the Dr. Tay. And podcast, you have a podcast called Evolve Autism. So check out all these things. Thank you so much for spending time with us today and giving us all this important information. Dr. Tay, appreciate you. And everyone can check her out if you're suspicious about your child possibly having neurodivergent symptoms. And you can stick around for more America Trends right after this quick break.